Now for neoplasms and cancer signs. In this video, we're going to be covering the pathophysiology of cancer, as well as risk factors, diagnostics, and early and late manifestations, also known as signs and symptoms, of cancer, as well as staging and tumor markers. So starting with tumor markers, also called TNM. This is a system used to describe the amount of cancer and also its spread or metastasis within clients' bodies. So the T is for tumor size, the size of the primary tumor. N is for node involvement, including the lymph nodes. This typically means a bad sign, because if cancer spreads to the nearby lymph nodes, which I call the highways of the body, it metastasizes or basically spreads very quickly. Now M is for metastasis of the primary tumor. This is the spread of cancer to other parts of the body. So cancer cells break away from where it first formed, this is the primary cancer, and travel through the blood or lymph system to form new tumors or metastatic tumors in other parts of the body. So the metastatic tumor is the same type of cancer as the primary tumor. So remember, at this stage, it's very hard to treat, as cancer is now all over the body. So for the memory trick, for M, for malignant, just think malicious or bad, basically cancerous, and easily metastasizes or basically spreads. And for B, benign, think be nice. This is non-cancerous. And think that it's bogged down in one place, basically meaning that it doesn't spread. It's stuck in one place. Now for the test tips. Malignant, number 1, we have rapidly growing cells. Number 2, there's a lack of specific form. And number 3, there's disorganized cells that spread to other parts of the body. This is known as metastasis or metastasis. Typically, these kind of cancers are non-encapsulated. Basically, they degrade or disintegrate and breach the capsule, and that is why they spread quickly and rapidly through the surrounding tissue. Now, this is unlike the benign cancers that are very slow or they grow slower, and a big sign here is that they're encapsulated. So nearly all benign tumors tend to remain in the same localized site of origin and are neatly enclosed in a little capsule consisting of connective tissue derived from the structures immediately surrounding the tumor. Now moving on to the 4 stages of cancer. So starting with stage 0, there's no cancer, only abnormal cells with the potential of becoming cancer. Now stage 1, we have a small or only one area of cancer involvement. And stage 3 is a little bit worse. There's large cancer involvement, and this cancer has grown into nearby tissues or lymph nodes, the highways of the body, which leads to stage 4, very severe. So this means the cancer is spread to other parts of the body, known as metastasis or metastasis. Now, stage 4 is often untreatable as it's spread throughout the body. Now, moving on to cancer risk factors, you should be sure to write this down. Number 1 is family history. This is known as genetics or oncogenes for oncology. So these are mutated genes that contribute to the development of cancer. In their normal unmutated state, oncogenes are called proto-oncogenes. They play key roles in the regulation of cell division. So these type of cancers are very true for family history of breast cancer, ovarian cancer, endometrial cancer, along with prostate and even pancreatic cancer, as well as skin cancer too. Now, another cause here is viruses, also called oncoviruses. For example, viruses that can cause cancer like HPV, the human papillomavirus. Next is radiation, typically from UV lights like sun tanning and even tanning beds. But also X-rays can play a huge involvement in radiation. Next is biological factors like hormone therapy, specifically hormone therapy with estrogen. Now, even though these hormones have essential pathophysiological roles in both males and females, they have also been associated with increased risk of certain type of cancer with hormone therapy. Now, age also plays a factor. So over 65 years old, 60% of cancers occur with clients over this age. And lastly, we have lifestyle and habits. So, a diet low in fiber, like low veggies, like broccoli and cabbage, and also low grains, as well as increased weight, obesity, a BMI over 25. Be sure to write that one down. BMI over 25. Big risk factor here. Another is alcohol intake, over 2 drinks per day. And a last one, as everyone knows, tobacco, basically cigarettes and chew, but even cigars too. Okay, now switching gears to the most tested topic here is cancer manifestations. Starting with the early signs. So number 1 is unusual bleeding. Tumor cells can erode nearby blood vessels, causing bleeding. And even anemia, that low blood count, as some cancer can affect bone marrow where those RBCs, or red blood cells, are made, reducing the production of blood. Next is unexplained weight loss. So please be sure to write this key term down. Cachexia is that extreme weight loss. It's basically wasting disorder that's caused by extreme weight loss and muscle wasting, and can include loss of body fat. Next is a change in urine and bowel habits. This typically indicates colon cancer for a change in bowel habits. Now, yearly fecal occult blood test is recommended for this. Next is the non-healing sore or thickened lump. Be sure to write down that key term there, non-healing sore. And we also see cough that is nagging, constant, or persistent, and hoarseness in the voice for months. Now, the next one here is big, so please be sure to write this down. Skin changes, specifically with skin cancer or breast cancer. So skin lesions that are key terms here, irregular or with uneven growth, typically are cancerous. And for breast cancer, orange peel skin with key term, small indented areas, big sign for breast cancer. The next key term is paraneoplastic syndrome. Now, this is a set of signs that manifest as substances released by tumors affect neurological function. So, for example, slurred speech, memory loss, and even seizures. Symptoms may include even difficulty walking or swallowing, with a loss of muscle tone, loss of fine motor coordination, and as mentioned before, slurred speech, memory loss, vision problems, sleep disturbances, dementia, seizures, sensory loss in the limbs, and even vertigo or dizziness. So all this really means is that there's a lot of signs in this paraneoplastic syndrome. So please be sure to write down neurological dysfunction. Now lastly, fatigue, that low energy, fever with night sweats, big key term right there, and effusions, or basically fluid buildup in body cavities. Now for late signs, we see number 1 is pain, number 2, obstruction, for example, obstruction of the digestive tract, or even airflow in the bronchi. And lastly, number 3 is tissue necrosis and ulceration. So please be sure to pause the screen and write these down. They love to show up on exams, specifically the highlighted ones here. Okay, now for the memory trick. To make this super simple, we have the acronym CAUTION for the 7 early signs of cancer. So please be sure to write this down. C stands for a change in bowel or bladder habits. A is for a sore that does not heal. U is for unusual bleeding in the stool. T is for a thickened lump in the breast or even testes. I is for indigestion or difficulty swallowing. And O is the orange peel skin with small indented areas. So once again, this typically always indicates breast cancer. And lastly, N is for no energy or fatigue, as well as nagging cough or voice hoarseness. Now let's play a little clip specifically for breast cancer. This is the uncontrolled growth of cells within the breast tissue. Now it's very deadly since the breasts are very vascular, with both lymphatic tissue and a lot of blood vessels that sort of act like the highways of the body. So cancer can easily spread to other parts. Now for the causes and risks, I would write these down. These are huge NCLEX tips. Obviously, number 1 is being a female, age over 50 that is common post-menopause. So write that down. Post-menopause showed up a few different times, as well as having a family history like a sister or mother with breast cancer. and a personal history like ovarian and uterine cancer, as well as a big one here that a lot of students miss. So write this one down. Genetic mutation, BRCA, in both men and women. So again, write that one down, BRCA. And lastly, early menstruation age. Now, in terms of lifestyle risks, weight gain and obesity are some of the biggest risks, as well as oral contraceptives, birth control, because they have estrogen and progesterone, and a diet that is high in fat and low in fiber, as well as alcohol and smoking. So I recommend pausing the screen and write down the bolded ones here, since these are typically the most tested on the NCLEX and nursing exams. Now, Saunders had a question about this. Educational session discussing the risk factors for breast cancer. Select all that apply. Early age menstruation, family history of breast cancer, high doses of radiation exposure to the chest, and previous cancer of the breast, uterus, or ovaries. Now for diagnostics, mammograms are essential for high-risk patients. They're done every year, aka annually. So no powders or lotions or perfumes before this test. Now there's a funny little meme out there that says, just a reminder that mammogramming your breasts are more important than Instagramming them. This is great for patient education. Now for breast cancer signs and symptoms, self-breast exams should be done on the same day every single month. And we always report to the HCP these NCLEX tips. Any red and warmth, or even orange peel looking skin, as well as a pitting appearance with small indented areas, just like an orange with dimples on the surface of the skin. So write this down. Orange peel looking skin, as well as small indented areas. Now the breasts will have hard, painless swelling and immobile, or basically fixed breasts. So no pain or discomfort until it spreads to nearby tissues. So once again, pause the screen and write down the bolded and highlighted ones here. Now the NCLEX will try and trick you with two other conditions here, like fibroadenoma, a benign breast disorder which is non-deadly. So just think benign is like be nice. It's a nice one to have. And malignant is the bad one. So just think MAL for malicious, the bad form of cancer. So fibroadenoma, we have round, painless, mobile lumps. Typically, most benign cancer will present as round, and the malignant, deadly ones are usually oddly shaped. Now, fibrocystic disease is also benign. These are nodules that are soft and mobile. The key term here is mobile. And another key term to write down is that breast changes in size during menstrual cycles, as the size correlates to the level of estrogen and progesterone levels. So the key point, a big sign of malignant cancer, we report breast changes that are not related to the menstrual cycle. So write it down again, report the breast changes that are not related to the menstrual cycle. Many students get this wrong, so just be sure to know those key words. Now switching gears to mastectomy. A mastectomy is a surgery to remove the whole breast or partial breast. And sometimes lymph nodes are removed too, which places the client at higher risk for both infection and swelling. So the big key point is post-operative care. Blood drainage from a Jackson-Pratt bulb, we must report to the HCP over 100 mLs of bright red drainage. This is the priority action here. Now the drain is ready to come out when 25 mLs or less of drainage is seen within 24 hours. But again, over 100 mLs of bright red blood is the priority to report. Okay, now lastly for cancer diagnostics. First up is labs, or basically blood tests. A tumor marker is used called PSA, prostate-specific antigen. Now, this is the most important tumor marker for prostate cancer, but it's not 100% accurate as PSA is also secreted by normal prostate tissue, and with BPH, that benign prostatic hyperplasia. Sometimes we have false positives very frequently. So imaging can also be used to visualize the tumors. So for example, X-rays, ultrasounds, MRIs, and even CT scans. Now, if cancer is suspected, a biopsy can always be taken, where we take a small sample of tissue to see if a tumor is cancerous or benign. This is considered the most accurate in confirming malignancy, meaning cancerous. All right, that wraps it up. Thank you so much for watching. Don't forget to take your quiz and download the study guides. And also feel free to share the love, share with a classmate and even your instructor. Now for the practice questions on cancer. So question number 1. Which client statement alerts the nurse to one of the 7 warning signs of cancer in adults? So remember the memory trick caution, the 7 signs of cancer. As you can see, I is for indigestion and difficulty swallowing. So D would be the most correct here. I feel like I have a lump in my throat when I try to swallow. In other words, difficulty swallowing. Now option A is incorrect. I wake up feeling nauseated with severe headaches. No, this is wrong. A top warning sign of cancer does not include nausea or even severe headaches. And option B, my eyes look different from others in most pictures. No, this is technically not a warning sign here. Now, eyes that look different in pictures could actually mean eye cancer, but that is typical of pediatrics and not adults, called a retinoblastoma, which we cover in a separate video in the pediatric course. Now for option C, I've been running fevers for the last 2 weeks. Now this one was really close, but it's incorrect. Running fevers is actually a sign, but a key term that was not mentioned is night sweats. This would be a classic sign of adult cancer. So once again, option D is the most correct. I feel like I have a lump in my throat when I try to swallow. Yes, the key term that we're looking for here is swallowing difficulties. Now, question number 2. The nurse is caring for a client scheduled for a biopsy of a tumor. The client asks what distinguishes benign tumors from malignant tumors. Which response is most appropriate? So recall your memory tricks and test tips here. So once again, the memory trick, think of the M's for malignant is malicious or basically bad cancer that often leads to metastasis. And the test tips is rapidly growing cells, number 2, a lack of a specific form, and 3, disorganized cells that spread to other parts of the body, that metastasis. And the B for benign is like be nice. This is non-cancerous as it is bogged down in one place, typically growing slower and encapsulated. So let's take a look at the options here. Option A, benign tumors are usually composed of more rapidly growing cells. Oh man, completely wrong. Malignant tumors are those tumors that have rapid growing cells. Now, option B, benign tumors are incapable of causing damage to nearby tissues or organs. This is incorrect. Benign tumors can actually cause damage to nearby organs like in BPH, in the prostate. So BPH is that benign prostatic hyperplasia. And option C, malignant tumors are usually encapsulated, while benign tumors lack a specific form. No, this is completely opposite. Benign tumors are the encapsulated ones since they are be nice for benign. Now finally, option D, malignant tumors are made of disorganized cells that can spread to other body parts. Yes, this is the most correct here. So remember the 3 M's. M for malignant tumors are M malicious, since they love to metastasize or lead to metastasis. Lastly, question number 3. During a routine physical examination, a firm mass is palpated on the right breast of a 35-year-old woman. Which of the following findings or client history would suggest cancer of the breast as opposed to fibrocystic disease? So before looking at the options, remember the test tips here. Fibrocystic disease is that benign. Nodules are soft and mobile, and breast changes in size during menstrual cycles. And the big key point is it's malignant cancer. We report breast changes that are not related to menstrual cycles. So option A, an increase in breast size not related to menstrual cycles. Yes, this is correct. This is a huge indicator of malignant cancer, so it must be reported that breast changes are not related to menstrual cycles. Now, option B, a history of heavy caffeine use. No, this is completely wrong. This is not related to malignant cancer. Rather, the use of alcohol and smoking is. Now, option C, sensitivity to touch in the areas of the mass. No, incorrect. Malignant cancers are typically painless, usually no pain present until it spreads. And lastly, option D, a history of early menarche or menarche. No, once again, this is incorrect. Early periods is not a factor of breast cancer. All right, that wraps it up. Thank you so much for watching. Don't forget to take your quiz and download the study guides. And also feel free to share the love, share with a classmate, and even your instructor. See you guys in the next videos. Now for brain tumors. A brain tumor is a mass or growth of abnormal cells inside the brain. Some brain tumors are benign, which are non-cancerous, and some brain tumors are malignant, which means cancerous. So you don't want to have the malignant ones. Now for primary malignant brain tumors, it's very invasive and very difficult to remove, often unoperable. Now for the causes or etiology, a prenatal exposure to carcinogens and embryonic development is a main cause. And for adults, typically we don't know predisposing factors. Now for manifestations or signs and symptoms, it all really stems from increased ICP, that increased pressure inside the brain. So number one, we're going to see seizures. Number two, we're going to see signs and symptoms of increased ICP. For example, headache, vomiting, and mental status changes, or a change in mental status, as most textbooks like to say. And lastly, number three, this is a big one, death before general signs and symptoms, those manifestations. So we'll see this 1, 2, and 3 progression when a client has a severe brain tumor. All right, that wraps it up. Thank you so much for watching. Don't forget to take your quiz and download the study guides. And also feel free to share the love, share with a classmate, and even your instructor. See you guys in the next. Leukemia is a type of cancer that affects the blood cells and bone marrow. You see, bone marrow is responsible for making blood cells like WBCs, RBCs, and platelets. But in leukemia, we have an overproduction of white blood cells that crowd out the production of normal cells, leading to low RBCs and low platelets. So let the name help you here. Leukemia, just think leuc for leukocyte, that WBC, and emia for blood. Too many WBCs that crowd out the production of other blood cells. Now the main types of leukemia, we have acute and chronic. So acute is more common with pediatrics, and chronic is more common with older age. The four main types include AML, CML, ALL, and CLL. Now the NCLEX doesn't really cover this directly. Okay, now specifically for your pathophysiology class, please be sure to write this down. It's very important. So acute leukemia, we see immature non-functional WBCs, those white blood cells. So think acute is abrupt onset, very common in children. And for chronic leukemias, we see mature cells with reduced function. So this one is a slower onset, known as insidious, and proceeds gradually. So we commonly see it in older adults. Now in terms of labs, we have high WBCs, but they are very immature and too young to fight infection. So we call them baby WBCs that crowd out the production of RBCs and platelets. So naturally, we see a low H&H, that low hemoglobin and hematocrit, and low platelets, which leads to higher risk for bleeding. Now the signs and symptoms include frequent infections, because the WBCs are too immature, and remember, too young to fight infection. We also see fatigue and an unsteady gait, as well as pale called pallor. This is from anemia, that low H&H. So just think we have less oxygen carriers and less perfusion to the brain, skin, and muscles, looking very anemic. And we have bruising, petechiae, and easy bleeding from the low platelets, as well as weight loss and anorexia, and even bone pain from the bone marrow being overcrowded with an overproduction of WBCs. So ATI mentions a 7-year-old with acute lymphoblastic leukemia who is being admitted for evaluation of fever. To which of the following rooms should the nurse assign the client? A private room in order to prevent transmission of infection from others. Yes, we want to protect this patient from getting other infections. Very low immune system from those immature WBCs. Now, a second question, a nurse is assessing a child who has leukemia. Which of the following findings should the nurse expect? Select all that apply. So we have anorexia, petechiae on the extremities, and even an unsteady gait. And the third question, a child who has leukemia has a platelet count of 40,000. Oh man. Remember, anything less than 50 gets very risky. Which of the following precautions should the nurse initiate? Bleeding. So remember, anything less than 50 is very risky. Big time bleed risk. Now, in terms of diagnostics, we can do a bone marrow biopsy, typically taken from the posterior iliac crest, basically on the hip bone here. So Hesse mentions, a nurse is preparing a patient for a bone marrow biopsy, knows which site will most likely be used. Posterior iliac crest. Now, in terms of the treatments, we use radiation and chemotherapy to kill everything off, the good guys and the bad guys too. And very rarely we use a stem cell transplant, like hitting the restart button to reboot the entire system for bone marrow. Alright, that wraps it up. Thank you so much for watching. Don't forget to take your quiz and download the study guides. And also feel free to share the love, share with a classmate, and even your instructor. See you guys in the next videos. Now for lymphoma. This is a cancer of the lymphatic system, which is the body's disease-fighting network, including the lymph nodes, which are the drainage tubes that help to empty waste, and the spleen, which I call the barracks that house the WBC white blood cell army that help to defend the body against infection, and the thymus gland and the bone marrow. Now there are two types of lymphoma, Hodgkin's and non-Hodgkin's. I would be familiar with the names here, and that they indicate a deadly form of cancer. You don't have to know the specifics for each. Well, there's one thing for diagnostics. So in terms of diagnostics, a biopsy of the lymph nodes will reveal in Hodgkin's those Reed-Sternberg cells. I would write that down. This one loves to show up on nursing exams. And non-Hodgkin's, just think non-Reed-Sternberg cells. So Hesse mentions, what is the main diagnostic feature of Hodgkin's disease? Reed-Sternberg cells. So please just know that. Now for the causes. About 50% of the cases are caused by Epstein-Barr virus. This is typically common in underdeveloped countries. So I'd write that down, Epstein-Barr virus for lymphoma. Now symptoms include enlarged lymph nodes, fatigue, and weight loss. So write it down. We have painless bumps and lumps under the arm. Lymph nodes in the axilla are affected. So write it down, painless bumps and lumps under the arm, as well as enlarged lymph glands, a fever with no chill or feeling bad, as well as weight loss that is unintended with no diet or exercise, which is a common sign for a lot of cancers. Now another big key term is night sweats. Clients will typically complain of changing their sheets in the morning, indicating night sweats. Now, because the immune system is suppressed, these clients are susceptible to infections. So Hesse mentions, a nurse is caring for a patient with Hodgkin's lymphoma, knows that a patient is at increased risk for which complication? Infection. And Saunders mentions, Hodgkin's disease, which assessment findings noted in the client's record are associated with this diagnosis. Select all that apply. So we have fever, weight loss, night sweats, and enlarged painless lymph nodes. So be sure to know those key terms. Now for the treatments. Just like nearly all cancers, clients are treated with chemotherapy and radiation, which we cover in a separate video. Alright, that wraps it up. Thank you so much for watching. Don't forget to take your quiz and download the study guides. And also feel free to share the love, share with a classmate, and even your instructor. Now for skin cancer. This is uncontrolled growth of cells within the skin, and we have various types. So basal cell carcinoma is the most common, but it's slow growing and rarely spreads. Squamous cell carcinoma is the second most common, and Kaposi sarcoma, which is a huge NCLEX tip. Write this one down. We see patches or lesions of abnormal tissue growth that look like purple, red, or brown skin blotches. So just know these key terms here. And the last one is melanoma, which is the deadliest form of skin cancer, since it spreads very quickly, involving moles. So we call it molenoma for melanoma. Now Saunders mentions, a client diagnosed with melanoma, which statement by a client indicates that education was effective. It is highly metastatic. Now to define some terms, a mole is called a nevy, and a tumor is called a neoplasm that develops if there is a DNA mutation. Now some tumors can remain benign and stay well contained, while some become malignant and very deadly. So the memory tricks, just think benign is like be nice, it's non-deadly. And malignant is very malicious, very, very deadly. So be sure to write that down. Now metastasis or metastasis means that the cancer is spread to other locations in the body, as mentioned before. Like when a malignant tumor gets inside the nearby blood or lymph vessels, it can travel from the primary site to the secondary site elsewhere. Now, in terms of signs and symptoms, screening for skin lesions is the biggest key point. The key here is prevention, so we must educate clients to be vigilant on screen lesions. Anything that is changing in size, color, or dimension is bad, and typically means that it's malignant or deadly. So the A, B, C, and D are the biggest NCLEX tips for screening. So write this down. A for asymmetry. Just think irregular is bad, or think irregular is not regular. Something is wrong here. So a half raised or half flat that is not round, then we have asymmetry. So the key terms here, half raised and half flat. This is bad. Now B is for border irregularity. Remember, irregular is the key term, with uneven edges. So write that down. C is for color variation and changes. We do not want a mix. So a mix of brown, tan, black, and even red, or the worst here, a black or dark lesion, are typically indicating of necrosis. Not a good sign. And D is for diameter, anything over 6 millimeters. Commonly described on many question banks as lesion is the size of a coin or a nickel. So just think the size of a nickel is over 6 millimeters. And lastly, E is for evolving, changing in size, shape, and color. Remember, any type of change in size, dimension, color is a bad thing. So write these down and focus on the highlighted ones here because these key terms came up a lot on the NCLEX. Now another big NCLEX tip is the key terms, irregular or uneven growth. Remember, this is bad. And even change. A lot of question banks use the key terms abrupt, sudden, or rapid when describing color, size, and shape. All these key terms indicate that it's bad for the lesion. So teach clients to report to the HCP for a follow-up immediately. This could mean deadly malignancy. Now, a little side note here. A full workup for every single mole is not necessary. Only the ones that are changing or have uneven growth or irregular growth here. So Hesse mentions, the nurse notes widespread nevy across the body. Which characteristic, if demonstrated by one of the nevi, would cause the nurse to be concerned about malignancy? Irregular border. Yes, we want a round border. Anything that is irregularly shaped is bad. Now, in terms of diagnostics, a tissue biopsy is required to make a definite diagnosis of skin cancer. But again, the key term here is that all new growths and pigmentation do not need to be biopsied to rule out cancer. Only the ones that show irregular changes, as mentioned before. Now, for the causes and risk factors, we have environmental or genetics. So for environmental, the big NCLEX tip is exposure to UV light. Now, this is the most tested since it's the most common. So we want to avoid tanning beds. Write that one down. Like the old Jersey Shore TV show here. Gym, tan, and laundry. No. No tan, just the gym and the laundry. Now, sun exposure is another key term. So write this down. Frequent sunburns as well as an outdoor occupation. Huge risk for skin cancer. Now for genetics, the NCLEX tips that we highlighted below, I'd write these down. Family history of skin cancer, like a father or mother with melanoma, and even Caucasians with light skin, blonde hair, and freckles, due to the fair skin that is more easily burned. And a high number of moles. This indicates a big risk for skin cancer. And lastly, the use of immunosuppressant medications, like HIV medications and long-term anti-transplant drugs, which lowers the body's ability to defend against cancer. So I suggest pausing the screen and writing down the highlighted ones here, as these are the most tested out of 5 different textbooks. So Hesse had a question: what would the nurse advise a patient to avoid to minimize the risk of skin cancer? Tanning beds. Yes, we want to avoid the tanning beds. All right, that wraps it up. Thank you so much for watching. Don't forget to take your quiz and download the study guides. And also feel free to share the love, share with a classmate and even your instructor.